Hi, my name is Brittney Dean, and I'm doing my Explore Disease Ecology over congenital and prenatal cytomegalovirus infection, also known as CMV. I decided to do this infection because I'm going into nursing school and I want to specialize in labor and delivery. So I wanted to do a little more research on a virus or infection that can cause issues with the pregnancy as well as the unborn child. So starting out, what is CMV? CMV is a type of torch infection where torch stands for toxoplasmosis, other, rubella, cytomegalovirus, and herpes. CMV is part of the herpes viridae family. It's transmitted through bodily fluids such as urine, saliva, cervical secretions, blood, semen, etc. 50 to 85% of American adults have already been exposed to CMV, and the majority of those exposures happen in childhood. Infected individuals will have a mild cold or flu-like symptoms for 1 or 2 weeks, and some have no symptoms at all. Once one is infected with CMV, they usually gain immunity unless another form of CMV comes along, which we'll get into that later. There's no vaccination for CMV currently, and infants can be infected with CMV prenatally, before birth, or perinatally, which is after birth. So here I have a quote from one of my sources. It states cytomegalovirus CMV is frequently isolated from the neonates. Although most infants shedding this virus are asymptomatic, others have life-threatening illnesses and devastating long-term sequelae. So this means that CMV is independent of the congenital variation where infants are diagnosed by the passing of the disease during pregnancy or during birth. Also, this says that some children that are born with CMV don't necessarily have symptoms. This is usually determined by when in the pregnancy the woman contracts the virus, so that's usually most detrimental in the beginning of her pregnancy. So when that does happen, these infants can have life-threatening illnesses as well as other disabilities. So now we're going to talk about some of the causes of CMV and what CMV does. So as we said before, CMV causes infection and defects in the fetus. This happens because the mother is infected by CMV for the first time. There is a reactivation of an old infection, or a new strain of CMV has entered the body. So CMV is cytopathic, which means cell damaging. It replicates inside the cell and breaks down the cytoskeletons. It enlarges the cell with intranuclear viral inclusion, and it can also slow down the mitosis process, so the tissues with the infected cells might not grow properly, which leads to some of the defects. CMV also invades the endothelium of the blood vessels, leading to vasculitis. This narrows the vessel wall and not enough blood flows to the organs of the fetus. It can also increase and decrease the amount of amniotic fluid. There are a couple ways an infant can contract CMV. The first is congenitally, which is during pregnancy. CMV births happen about 0.2 to 1% worldwide. Although this is a very small percentage, it is still the most common form of infection in an unborn child. CMV is transmitted through primary or recurrent maternal infection. The disease is apparent in the first half of pregnancy, which I stated earlier. So if the mother contracts the virus during the first half of her pregnancy, then that's when CMV will be most detrimental. In the U.S., 50% of young women lack the antibody to CMV, and this is a long list of signs at birth, but in my research, the most common that I found were prematurity, cataracts, microcephaly, and petechiae. The second way an infant can contract CMV is perinatally, which happens after birth. This can happen due to exposure to cervical secretions, breast milk, or blood products. Maternal antibodies are thought to be protective, and most full-term infants are asymptomatic or not infected at all. So that basically means that if a child is full-term, then it will most likely be asymptomatic. But the issue comes with premature infants, which they lack the antibody, they develop serious infections or can possibly pass away. Transfusions with CMV positive blood can also cause them to develop CMV. So here again, another list of signs after birth, which is not as long because the impact of perinatal CMV is not as bad as congenital. But the most common I found were signs of pneumonia, sepsis-like syndrome, and hepatitis. So now we're going to talk about some of the signs and symptoms of CMV. So many women who become infected with CMV during pregnancy are usually asymptomatic, but some may develop mononucleosis-like illnesses. So the women themselves, while they're pregnant, they will not know that they contracted the virus. This is usually detected during ultrasounds or other things of that nature. 10% of infants with CMV infections are symptomatic at birth. So these are the infants that have contracted CMV congenitally. Again, here's a long list of different manifestations of CMV. Infants who acquire CMV after birth are typically premature. So like I said before, babies that are born full term with CMV don't typically have any symptoms. And something that I found interesting was that babies who contract CMV through breast milk usually have a lesser risk of symptomatic diseases, and the long-term effects of the disease are low. So looking at these pictures on this slide, the top picture is an example of petechiae. This is also known as the blue muffin spots. The second picture is cataracts that can develop during CMV as well. This baby also has the blue muffin spots. And another common defect is the microcephaly, and that has deformations of the head and the ears. And based off my research, all three of these defects or infections are the most common and most easily recognizable among CMV. So here are some ways that CMV can be diagnosed. Before the baby is born, CMV can be diagnosed through an ultrasound, also by amniocentesis, which they take samples of the amniotic fluid, fetal blood sampling, where they go as deep to take blood samples from the fetus. After the baby is born, if they show signs of CMV, they can do a PCR test where they isolate the virus to see if that's what's actually causing their symptoms. This usually happens when newborns are less than 3 weeks of age. Some of the ways that CMV can be easily diagnosed are microcephaly, which can be seen in an ultrasound or when the baby is born, skin rashes like the petechiae or the blue muffin rash, also by enlarged liver or spleen. So newborns go through several different kinds of screening, one of which is hearing loss. Hearing loss is also a big indicator of CMV. So if a newborn fails their hearing test, they will usually go through additional screening for a CMV diagnosis. Some of the treatments include prescriptions like ganciclovir or valganciclovir, which are both antiviral drugs. Valganciclovir is taken orally 2 times a day for 6 months at the dosage of 16 milligrams per kilogram. This itself decreases viral shedding and can modestly improve hearing and developmental outcomes when taken at the ages of 12 to 24 months. The main toxicity of this treatment is the neutropenia, which is the reduction in blood and neutrophil count. Some of the ways CMV can be prevented is by pregnant women taking extra precaution. So non-immune pregnant women should limit their exposure to this virus by washing their hands more frequently and limiting their exposure to urine and oral or respiratory secretions from children. A lot of these children that carry CMV are typically in daycare centers, so women who are pregnant and work in daycare centers should take extra precaution when handling these children. Also, another way CMV can be prevented is by testing blood transfusions given to premature children who are more susceptible to the virus after birth. Also, just by testing blood for transfusions for the CMV virus can also prevent the transmission of the virus. Based on my sources, a vaccination is under development as well. So here's a list of my sources. You can also find my in-text sources at the bottom right-hand corner of each slide. And thank you for listening, and I hope you have a good rest of your day.